Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership and Business Podcast, where urologic professionals experience the practical application of business acumen essential to successfully navigating today's rapidly changing business environment. I'm Dr. Jennifer Miles Thomas, and in today's episode, we will discuss practical steps for leadership development. Joining me today for this very important discussion is Dr. David Albala. Dr. Albala is currently the Chief of Urology at Crouse Hospital and a member of Associated Medical Professionals in Syracuse, New York. He is considered a national and international authority in laparoscopic and robotic urologic surgery, and he has been an active teacher in this area for over 20 years. His research and clinical interests have focused on robotic urologic surgery. In addition, other clinical interests include minimally invasive treatment of BPH, biomarkers in prostate cancer, and the use of fibrin sealants in surgery. He has been a visiting professor at numerous institutions across the United States and has done operative demonstrations in over 32 countries and 23 states. He has trained 19 fellows in endourology and advanced robotic surgery. In addition, he is an active member of LUGPA as well as the AUA Leadership and Business Education Committee. Welcome, Dr. Albala.
Thanks so much, Jennifer. It's really a pleasure to be here, and I'm really looking forward to this podcast. It's a very interesting topic, and I think it's really salient for many of the members of the AUA and urologists around the world.
I agree. So let's get started. So can you give us any insight into the question? This is like a fundamental question we all have. So are leaders born or are they made?
Well, I think it's a really interesting question. I think all of us have heard the expression, a born leader, and that phrase implies different qualities that make a good leader are innate. In other words, having charisma. I think many leaders, in the business world and in politics are very charismatic. They have humility and a sense of humor, but really only about a third of leadership qualities are hereditary. And really most leadership qualities are learned. And I think, understanding that you can learn to be a good leader is really the first step in developing leadership skills. I think that effective leaders, focus on emotional intelligence. And what I mean by that is that they really have an understanding of people, interactions with people. And to me, it's leadership skills and the development is really a journey of progressing and developing skills that are extremely important. There have been a lot of studies looking at whether leaders are born and have a hereditary component, or are they learned? And I think many scientists have really felt that leadership skills can be learned, and you can learn to become an effective leader. And leadership has different connotations. I mean, it's directing and working with other people, having clear communication. And we'll talk about different leadership styles and skills that I think can be developed.
Well, I think that's great. And I think it's great that you mentioned too that it's a journey. So that means that individually, all of us can improve and travel and learn along that kind of continuum and become better leaders in the future. So if we talk about leadership, if we talk about the individuals who are leaders, how would you describe or define a successful leader?
Well, I think, most leaders that are successful are well-rounded. They provide guidance and inspiration to everybody around them. So, I like to think of as a leader as somebody that's going to inspire, success, and they're confident. They sometimes have the courage to stand up to things that, may not be the popular choice. And they really successful leaders, have possess a growth mindset. In other words, they're looking to the future. Even though they're living in the present, they're looking to the future, and they have a variety of skills that are important. Confidence and courage to me is extremely important, and understanding to be able to stand up and understand this sort of self-awareness and prioritize, personal development. To me, I think, this emotional intelligence that we talked about, is extremely important. And, you have to be adaptive, you have to be resilient, and you have to accept feedback from others. So to me, that's sort of one of the basic skills that we see, to be a successful leader. And it can be a leader in a group, a subcommittee, a part of a practice. It could be a leader in a department. It could be a leader for a practice. But the skill sets are all the same. It's just modifying them to adjust to the position that we're looking at.
I would agree. And I think some of the things that you said about resilience, positivity, definitely in this environment of healthcare, that's definitely some of the trademarks and the traits that I would look to for our future leaders.
It's interesting. It's interesting because, one of the most important things, that you see in leaders is communication. And, I'm in the process of doing my lifelong learning. And, the other night I was doing the safety modules, one of the biggest mistakes that are made in surgery is lack of communication. And I think that good leaders have this ability to communicate on different levels. We work with, physicians, we work with nurses, we work with clerks, and you have to be able to relate to them and communicate to them. And to me, this effective communication is extremely important. And I think that's one of the really basic foundations for leadership skills. There are other, characteristics which we'll dive into, but just think about the people that that can communicate well. When I think of, in politics, I was fortunate enough to spend a year in a leadership program working in the White House. And I left my practice and went to work in Washington with a cabinet secretary with Donna Shalala and Federico Pena. And one of the things that I learned, it didn't really help me in my urological career of taking care of urological patients, but what it helped me with is understanding how to communicate to various groups of people and tailoring the message towards those individuals. And that effective communication really, brings positivity. It brings creativity in other individuals. And as the boat rises, as you make the boat rise, everything's going to be better. And, one of the key foundations for me was effective communication. And, in the operating room and when I was doing the safety modules, the biggest problem where problems develop is when there's lack of communication. And I don't know, I'm sure you've seen it in your practice. You run a very large practice, in Maryland. And I think that those skills are really probably some of the most valuable ones that you have.
Yeah, I think you hit the nail on the head. Just learning to communicate at different levels is something that's very, very important for leadership because the conversations aren't just the words, it's the tone, it's the manner, it's the cadence that you communicate with others. And I think was it, I think it was Oprah who said, people won't always remember what you say, but they'll always remember how you make them feel. So making sure that when you are in a position of leadership, that you take into account who you're speaking to, how you're speaking to them, to make sure that your point, your message, is communicated well. And I think that's something too for our future leaders that we probably do have to spend more time in cultivating. I think throughout our surgical training, we've always kind of, like you said, in the OR, we've like been in charge and we're just communicating with nurses, but we're in positional authority at that point. And when we have conversations with our peers, we're no longer in positional authority. We're having conversations with our peers. And sometimes there's miscommunications because we forget that and we forget how we're communicating with others and that we're not always in the OR. So I think it's very, very important. Well, one of the things that you did you want to say something?
Yeah, I just wanted to say, I think that's so important because, successful leaders, focus on others, on trying to develop others, on, how to make others better. And, it's not about you as an individual. Good leaders lead, by example. I think, I can tell you a good example. When I was in my training and when I started practicing, one of the chairmen that I've always looked up to has been Jay Smith, who is at Vanderbilt. And Jay is, an incredibly smart guy, was the editor for the Journal, of Urology. But what was interesting about Jay is Jay led by an example. Same thing with Bob Flanagan. These guys are polished scientists, physicians, and they did the grunt work. They were surgically busier than almost anybody, and they led by example. And but they always put the junior faculty, and tried to develop the junior faculty to become better and push their careers. Those guys were really accomplished. They published and had all these accolades, but I think they got more satisfaction, and I think true leaders get more satisfaction out of seeing somebody junior develop and blossom. We saw that in our residencies. I think to the day when I first did my first circumcision, I had sweat pouring down my back, and I was so nervous because that's the most commonly sued urological operation. And when I was a resident, and my first year as a resident, they let me in the OR and they said, "We'll be right down," and I'm doing this case and nobody's coming. It really was humbling. But sometimes you need to push people in a good way, and leaders do that. And I still remember the days when I was a resident at Dartmouth, and the people in your careers, you find a mentor, and whoever that mentor is, whether it's a faculty member, another physician, they take an interest in you. And a real leader promotes their junior people, whether you're in a private practice, you're in academics. But I think it's important that when you're young in your career, you find a mentor, a leader that you look up to, and try to emulate them. And I can tell you, I've been blessed with my career and had some terrific mentors. But I remember the people that really took the time to spend and nurture me. And so this development of others is critically important too, I think. And I just wanted to put that plug in for how leadership really can be positive, not only for a mentor, but for you as well.
I would completely agree. Completely agree. Well, one of the things that you did mention was this kind of self-awareness. So at times, we all know that it may be challenging for others, and sometimes for ourselves to be self-aware of our situation, our language. Um, how would we go about developing that skill? How would we become more aware?
Well, I think understanding the situation that you're in, is critical. I mean, leaders have a variety of skills. They have, this confidence and courage we talked about. They have a vision, they have focus, positivity, resilience, creativity, the ability to inspire other people, but I think leaders, and I look at how I tend to have some leadership skills. I'm a very goal oriented person. I need to set a goal to have, I have to see the prize, and I have to understand what the boundaries are, focus on the bigger picture, see where you can develop, how that's going to develop, seek feedback, I think is extremely important. I think you have to be humble enough that, maybe your opinion is maybe not right sometimes. And most leaders accept feedback with gratitude, because they're trying to understand maybe that there's a different perspective. And I think good leaders, and I think all of us have been in situations where we can anticipate difficult situations developing, whether it's personnel or whatever. I think that's extremely important.
So I would agree with you. Seek feedback. So I think one of the skill sets that's fairly difficult, but we need to master as leaders is to take anything personal out of the situation and try to evaluate it very, very um, from afar so that it's no longer us in that situation versus the other person, but we're trying to like critically analyze whether or not additional information would have changed our judgment or our decision. And I think that's very, very difficult. We've grown up in a world where it's our opinion and our thoughts, and then when you become a leader, it's the collective and what's the best for the collective versus the individual. And so sometimes we may go astray, but hearing that feedback from someone else kind of lets you know whether or not you've been considering the collective and your responsibilities. And the other thing I would say is that when you mentioned anticipate difficult situations, what I feel is helpful is to kind of role play it out or play it out beforehand. You don't know what you don't know, but it's always really important to have either that call or the conversation or the meeting before the meeting to really figure out what may be coming at you and then how to communicate your position as well as to prove the data or the evidence to help support yours. Everything is how you tell the story. And in any difficult situation, there is a resolution. You just have to make sure that it doesn't become personal. And I think you can be a very effective leader that way.
I would agree completely. I think effective leaders develop teams with diverse skills and opinions. And I think that, you need to show empathy, you need to delegate tasks as a leader. But I think importantly, you have to make connections with different people within the team. And, you're training individuals to to accomplish a goal, which as a leader, you've set that goal, you know what the boundaries are, and you've had the ability to focus on that bigger picture. And I think that that's extremely important. And when I think of all the leaders, in urology, there have been giants, that we've all of us have worked with. I mean, Carl Olson, for example, is just retired. And, I never worked with Carl Olson, but Carl Olson impacted my life in many ways. And you know, I mean, here's a giant that ran the journal for years, and many people when they took their boards were terrified of Dr. Olson, and he was a tough board examiner. But when you get to see his leadership skills, and over the years as I've gotten older and gotten to know him much better, I think to myself, no wonder this guy was the chairman of Columbia, and no wonder he's trained so many incredibly smart physicians. He's, a motivator. He drives excellence, and if you do something wrong, he'll tell you that. And you have to be honest and brutally honest with individuals, because, we all screw up at some point in different ways. And hopefully it's not something surgically, but, you always need to learn something. I remember one of my mentors said to me, I'm going to tell you this, you didn't know it, but now if I ever ask that question again, I want you to remember it. And I always remember that. And I take that, that experience of learning something and putting it in my memory and not making the same mistake twice is extremely important. And, I think back and I can name a number of instances when these leaders have really inspired me to succeed. And I think, when I worked in the White House, probably the most charismatic leader I met was Colin Powell, was one of them, and George Bush. When I met George Bush Sr., I mean, he was a gentle giant, but incredibly smart, sensitive, understanding the environments that he's in. And those kind of leaders make an impact on you, and they do affect your career, and I think do affect growth.
I would agree. Well, another part of being a leader or leadership is strategic thinking. So, how would someone go about developing a strategic mindset to begin strategic thinking?
Well, strategic thinking is really interesting. And I think, first off, you have to have a flexible mindset and be willing to try new ideas. I think that that's critical. You know, when I think of, leaders at startup companies, goals are frequently changing. When you first come into a job, you're trying to understand the environments, in the operating room, and when you first start, so you have to be flexible and not be rigid. I think you have to show an interest for regular growth. You know, strategic leaders think about growth. In private practice, we think about how can we deliver our services in a more effective way to patients. How can we be more cost effective? How can we save on doing certain things? So you have to have that mindset. You need to focus on the future and understand that change is occurring all around us, and you have to maintain a positive outlook. I think that good leaders are positive thinkers that think ahead. And then I think you have to encourage creativity and innovation. And I think this is the strategic thinking. As a leader, how can I do something differently and make it better and more cost effective? And then I think, with any kind of strategic thinking, you have to think about training. How can I, train individuals to be more effective in doing the way they do our jobs? We looked at our practice. Is it better to do a single day of like office cystoscopies versus, seeing 3 patients and then doing a cystoscopy? And thinking ahead and seeing which is going to work for the system that you're in, that's what leaders do. And I think that that's extremely important. And these behaviors that we just talked about, this flexible mindset, focusing on the future, really, I think are important skills to develop for strategic thinking.
I would agree. I think sometimes we're afraid to fail. And I think with strategic thinking, you have to have the mindset of, let me think about what may happen in the future. I may not be right, but I'm going to try something. I'm going to try to make this better for all. And I think we have to get over that fear. Of course, I would separate the business side and the practice side from actually like in the operating room. I practice standard of care, but I would say that we have to be a little bit more brave, because I think the world coming at us is going to be very different than what we've seen in the past. And we need to work together to be a little bit more creative, a little bit more innovative, to preserve ourselves and the care for our future patients. So is there any, go ahead.
You're right there. You need to make informed decisions.
Mhm.
And I think, leaders often have to make risky decisions, but you need to be able to justify, your course of action. In other words, if I make a recommendation to close a clinic down in my practice, a satellite clinic, there has to be a justification on why you're doing it. And you have to think it well out, and you want to communicate and get all the information before you make that decision. And I think that that's extremely important in making decisions as a leader.
I agree. I agree. Is there anything else that you would think of as a practical step?
I think, one of the things I think we can put a plug in for is the AUA leadership. The AUA has done a terrific job on developing, leaders. They've had a leadership program for a number of years. LUGPA has done the same, and I would encourage anybody listening to these podcasts to look at these opportunities, because, in medicine, leadership skills aren't born. I think you need to learn certain leadership skills. And, I think both the AUA and LUGPA have done a great job at creating opportunities to develop leaders. And, when you go through these leadership, programs, you learn these basic skills, and then you can apply it to your practice. You can apply it to, everyday life, I think I look at my career and I've been blessed. I spent, 21 years in academics, and then, 10 years in private practice. And quite honestly, those leadership skills mean a lot. And, I was blessed to have an incredible leadership program in the White House. I run the leadership program for LUGPA now. The AUA's leadership program is terrific. So these opportunities are unique. I would encourage anybody listening to look at these opportunities, because the skills that you'll pick up really can't be bought. You need to put some learning into them. They're physician leadership programs that are out there that people can take. And, you can develop skills in negotiation, communication. All of these things, are the building blocks to a successful leader.
I completely agree. Well, thank you very much, Dr. Albala, for sharing your time and your expertise with us today.
It's been a pleasure, and I hope it's been a useful program for the audience. And I look forward to seeing you soon, Jennifer, at the AUA. And thank you again for inviting me.
Well, thank you very much. And thank you to our audience for joining us on the AUA Leadership and Business Podcast. Until next time.
Invest in your leadership and business skills at AUA 2023 with the new AUA Institute for Leadership and Business track. Join the Institute at the AUA annual meeting in Chicago for an opportunity to grow your leadership and business skills. The new ILB track features 7 courses, offering a combined total of 16 hours of programming that will enhance your business acumen, activate your interest in business and finance, and inspire you to become a leader in your practice and the field. To accommodate the robust schedule of AUA 2023, each of the 7 live courses will be recorded for access on demand after annual meeting. Resident discounts are available. Visit auanet.org/AUA 2023 to learn more and add the ILB track to your registration.